So yesterday, we announced 90,392 cases and 6,289 total deaths due to COVID-19 in the state. Overall, we believe we're seeing a plateau in cases after cases increased in June and July. We continue to be cautiously optimistic that we are trending in the right direction as a state. But the spread of COVID-19 continues to look differently by region. The Detroit region is at about 50 cases per million people per day, with 4.1% of those tests coming back positive. But I want to focus a little bit more on the Detroit region, which includes the city of Detroit, but also the surrounding Southeast Michigan counties. So much of the elevation in cases and percent positivity is related to the counties surrounding the city of Detroit. Detroit has a case rate of 26 cases per million people per day, with a positivity rate of 2.6%. However, Wayne, Monroe, and Oakland counties all have over 40 cases per million people per day and a positivity rate over 4%. Macomb County has the highest numbers in the region, with a case rate of 82 cases per million people per day and a positivity rate of 7.4%. So this is why it's so important that businesses, schools, and others work very closely with their local health departments to implement strategies to fight this disease at the local level. So let me talk a little bit more about the other regions in the state. The Saginaw region has a case rate of 50 cases per million people per day, with a positivity rate of 3.7%. The Grand Rapids, Kalamazoo, and Upper Peninsula regions are all at 30 to 40 cases per million people per day, with declining rates for the past 1 to 3 weeks and positivity under 3%. The Jackson region is at just under 30 cases per million people per day, with positivity just over 2%, and the Lansing and Traverse City regions are under 20 cases per million people per day, excuse me, and also have positivity under 2%. We also continue to focus on our testing. So last week, we reached our highest number of tests yet at over 38,000 tests in one day. And overall, the percent of those tests that are positive is at about 3.2%. And we also continue to see a low level of deaths. These are all good signs, and we continue to monitor these metrics. It's also important to note that we are not only looking at one day of cases that are reported, but trends over time. That's very important. And what we also know is that even if the trend is stabilizing, it only takes a few people to create an outbreak and have the disease spread rapidly in a community. We're still seeing outbreaks across the state in every region, and these are occurring in many different settings. The top categories for these continuing outbreaks are skilled nursing and long-term care facilities, social gatherings, agricultural and food processing facilities, child care and youth programs, manufacturing, healthcare, restaurants, schools, and colleges. And what these outbreaks mean is that the virus is still very present among us, and we must remain vigilant. One of the most important things everyone can do is wear a mask. Masks work, and they prevent the spread of the disease. I work in an emergency department, and I wear an N95 mask for my entire shift every time. My 3 school-age children wear masks, and they will wear them if they go back to school in person. This includes my youngest child, who's going into the 2nd grade. Even younger children can and should be taught to wear a mask when they are indoors or if they're going to be within 6 feet of someone else. And I encourage every school superintendent who is developing plans for in-person instruction to mandate masks for children of all ages, even in a classroom setting. I'm excited that we are announcing the My Mask Aid partnership to make over 4 million masks available for free to Michigan residents, including those who are most vulnerable to COVID-19. And I'm grateful for the leadership of Lieutenant Governor Gilchrist and MDHHS Director Robert Gordon, as well as Ford Motor Company, for working to make this project possible. No one should have to worry about where to get a mask or how they will afford one. And that's why we're making masks easily accessible for those who are the most vulnerable. Finally, I want to note that August is National Immunization Awareness Month. We know that we saw a significant decline in immunizations because of the pandemic, and people have been hesitant to seek important medical services. But please, especially parents, reach out to your child's doctor to ask about immunizations and to make sure that they are up to date. Our medical professionals have opened their offices back up, and they have important procedures in place so that they can take care of you and your family safely. There's not currently a vaccine approved for COVID, but there are many safe and effective vaccines for things like measles, mumps, hepatitis, meningitis, and the flu. So make sure you and your family are up to date on these critical and often life-saving vaccines. So I know it's been hard, and people are tired. There's uncertainty about how the virus will spread in this state. But we all simply have to focus on the things that we can control. We can all wear a mask. We can all wash our hands. We can keep our distance from others. We can pick up our phones if someone from the health department calls, and we can make sure our families are up to date on their vaccinations. So please do these simple things. If we all do this, we will see COVID-19 cases continue to decline, and we will beat this virus.